Hi viewers, today we'll see role of nurse in stem cell therapy. I am Dr. Kaliselvi Xavier, Professor, Tribhulam College of Nursing. What are the objectives of today's class? We will see meaning of stem cell therapy, purposes of stem cell therapy, state the indications of stem cell therapy, and list the side effects of stem cell therapy. Explain the traditional method of stem cell therapy, enumerate the importance of stem cell therapy, describe the laboratory method and research on stem cell therapy, and explain the nurse's role of stem cell therapy. In that we will see assessment, teaching, coordination and preparation. Stem cells are very important nowadays. It is helping for different types of conditions and diseases. It can be used in cellular therapy to replace damaged cells or to regenerate organs. These cells are also found in abundance in the umbilical cord, fetus and embryo. For the practical consideration, stem cells can be easily separated from blood using machines that is called cell separators. What is the meaning of stem cell therapy? It is also known as regenerative medicine. Okay, the cells become a blastocyst and become a stem cell. The stem cells will be divided in the ectoderm, mesoderm and endoderm. The ectoderm convert into neuron and the mesoderm convert into blood cells and the endoderm will convert to the liver cells. Same like the cells in our body that can form other cells, we have them in bone marrow. The stem cell can become any one of the two different cells in the body. Okay, what are the purposes we can use for the stem cell therapy? It is used for repair response of disease, dysfunctional parts, injured tissue using stem cell and their derivatives, for the organ transplantations, and also it is used for the donor organs which are limited in supply. The indications which will be used for spinal cord injuries, type 1 diabetes, Parkinson disease and amyotrophic lateral sclerosis, that is a progressive nervous systems of that affects have nerve cells in the brain and spinal cord which will cause the muscle control. Then we will be seeing for the indications Alzheimer's disease. It is a brain disorder that slowly destroy the memory and thinking skills, and even it is a stops the simplest role. Then heart disease and stroke, burns, cancer and osteoarthritis. These are all the other indications to treat for the stem cell therapy. What are the side effects when you are using the stem cell? There are the different side effects. There are the important side effects: mouth and throat pain, nausea and vomiting, infections, bleeding during the transfusions, interstitial pneumonitis and other lung problems, graft versus host disease. That is a condition that might occur often in allogenic transplant. Okay, what will happen? Because of the foreign or donated cells attack the body. Then hepatic occlusive disorder, that is a clinical syndrome which is characterized by hepatomegaly, ascites, weight gain and jaundice due to sinusoidal congestion, which will be caused by alkaloid ingestion. Then graft failure. The graft failure is a failure to achieve sustained engraftment following the allogeneic stem cell transplantation. There are the 6 stages of stem cell therapy. The first stage, the stem cells moved from bone marrow to bloodstream using chemotherapy or synthetic growth factors. Then the second steps, machine collects blood and separates out stem cell. The third steps, the stem cells frozen ready to return to body later. The fourth stage, the more chemotherapy or that synthetic growth factors used to fully or partially wipe out bone marrow and immune systems. The fifth stage, stem cells return to body using a trip, and the sixth step, body recover over a period of 3 to 6 months, sometimes longer. Now we'll see traditional method. In olden days, what will happen? No, we used to put holes in the bone marrow and suck them out, but this is no longer nowadays it is practiced. It is a stem cells used in the proper way can potentially cure blood cancer, lymphoma, myeloma, and other rare condition affecting the bone marrow, which is also treatments in India. The fraction of cost or as compared to other countries. The conditions for the thalassemia, sickle cell anemia, and aplastic anemia are curable by stem cell transplantation. It is being tried out for many other diseases, but these are all in early experimental stages only. What is the importance of stem cell therapy? The stem cells are important for living organism for many reasons. In the 3 to 5 day old embryo called blastocyst, the inner cells give rise to the entire body of the organism, including all of the many specialized cells types and organs such as the heart, lung, skin, sperm, eggs, and other tissues. What happened? Some adult tissues such as bone marrow, muscles, and brain describe population of the adult stem cell regenerate replacements for cells that are lost through normal wear and tear, injury, or disease. Given their unique regenerative abilities, stem cells offer new potential for treating diseases such as diabetes and heart disease. However, much more remains to be done in the laboratory and the clinic to understand how to use these cells for cell-based therapies to treat disease, which is also referred to as regenerative and reparative medicine. In the laboratory studies of stem cells, it is enables scientists to learn about the cell's essential properties and what makes them different from specialized cell types. Here the scientists already using stem cells in the laboratory to screen new drugs and also develop the model systems to study normal growth and identity the causes of birth defects. The research is going on stem cells continues to advance knowledge about how an organism develops from single cell and how healthy cells replace damaged cells in adult organisms. And also the research is one of the most fascinating areas of contemporary biology, that is many expanding fields of scientific inquiry. The research on stem cells raises scientific questions as rapidly as it generates the new discovery. The potential uses of stem cells, the baldness, blindness, deafness, as we discussed, amyotrophic lateral sclerosis, myocardial infarction, muscular dystrophy, diabetes, multiple sites, cancer, Crohn's disease, osteoarthritis, rheumatoid arthritis, spinal cord injury, bone marrow transplantation, wound healing, missing teeth, then stroke, traumatic brain disease, learning defects, Alzheimer's and Parkinson disease and all. This is mainly used for potential purpose. Whether can doctors use stem cell to treat patients? Because the some stem cells such as the adult bone marrow or peripheral blood stem cells have been used in clinical therapies for over 40 years. Other therapies utilizing stem cells include skin replacement from adult stem cells, which is harvested from hair follicles that have been grown in culture to produce skin grafts. So the other clinical trials for neuronal damage disease have also been conducted using neural stem cells. There were side effects accompanying these studies and further investigation is warranted. Although there is much research to be conducted in the future, these studies give up hope for the future of therapeutics with the stem cell research. What are the potential therapies? The first one is the adult stem cell therapies, which is the bone marrow and peripheral blood stem cell transplants have been utilized for over 40 years as therapy for blood disorders such as leukemia and lymphoma, amongst many others. The scientifics have also shown that stem cells reside in most tissues of the body, and research continues to learn how to identify, extract, and proliferate these cells for further use in therapy. Here also the scientists hope to yield therapies for diseases such as type 1 diabetes and repair of the heart muscles following heart attack. And also the scientists have also shown that there is a potential in reprogramming adult stem cell therapies to cause them to differentiate, that is turn back into the different cell type than the resident tissues it was replenishing. The second one is a embryonic stem cell therapies. This is to treat certain disease in future. The scientists continue to learn how embryonic stem cells differentiate, and once this method is better understand, the hope is to apply for the knowledge to get embryonic stem cell therapy to differentiate into the cell of choice that is needed for the patient's therapy, which will be being targeted with the embryonic stem cell therapy for the diabetic, spinal cord injury, muscular dystrophy, heart disease, and also vision and hearing loss. Then third one is a induced pluripotent stem cell therapy, which is therapy used for exciting because somatic cells of the recipient can be reprogrammed to an this is the pluripotent stem cell therapies like state. Then the mechanism to differentiate these cells may be applied generate the cells in need. This appealing to clinician because this avoids the tissues of histocompatibility and the lifelong immunosuppression which is needed to transplant use donor stem cells. And also the pluripotent stem cell therapy, it is a mimic most because of the ESC's properties in that they are pluripotent cells but do not currently carry the ethical baggage of the ESC the research and use because this pluripotent stem cell therapies have not been able to be manipulated to grow for the further outer layer of one embryonic cell required, which is usually for the development of the cell into the human being. Then the cardiac repair, mostly the for stem cell fusion is used for the injured heart. It will be enhance the perfusion of the heart and improve the capability and capacity of the heart and improve the functions and also remodeling of the heart in the different aspects. Here we will see now role of nurse in preparing patient for stem cell transplantation. Here the first interface many patients have with this HCT transplant, that is a hematopoietic cell transplant, which will be the IV infusions occurs at the time they come for the second opinion. Often patients make a consultation appointment to compare the particular program with the other centers their consideration. These patients meet with the transplant physician to review their option and the the financial counselor and they will come to the nurse. The nurse's role to assist the patient with this decision by explaining the logistic of the program, which usually length of the stay on the inpatient unit, how much the transplant process will be managed of the outpatient basis and all to be explained. And also the patient are interested in the nursing service or the program, they are considered to ask questions about the nurse to patient ratio. And also the responsibility of the patient's caregiver are reviewed in different aspects. Many families are concerned with the logistic of relocating and incorporating this intense therapy with their lives. And also the patients present with the myroid, the countless of questions and a nurse must be versatile in meeting the patients and families' informational needs. And also, the nurse often are also responsible for giving information regarding the transplant program to physician and nurses from the referring center as well as to third party payers. Here the workup prior to patient's arrival at transplant center, the first the nurse role is assessment whether they are understanding of the overall transplant process, time commitment, current symptoms from previous therapies or disease, whether they are coping ability, how the current pain level, and what is the current blood product requirements, and also the sedation preference for the procedure, or everything to be noted by the nurse. Here the teaching is a very important, the nurse's role, length of the time for the workup, mobilization and transplant process, role of the caregiver each stage, care coordination with the different team members and the healthcare workers, confirm the family who is going to be accompany the patients, or a friend plan for caregiving, contact referring physicians and office to obtain report, confirm financial clearance and also confirm housing plan, and also carrying of the medical care plan to for the knowledge of the proposed transplant plan of patients. Workup once a patient has met initial screening, has decided to undergo hematopoietic cell transplantation, the scientific center, the nurse primary responsibility become educations. The patient must understand the specific of the rigorous evaluation, coordinating and timing of care during this phase is especially critical if the patient is as a unrelated donor. And also completion of the workup and initiation of the conditioning must also start on an exact date to allow that hematopoietic cell transplantations infusion on the planned date of HSC procurement, and also the generosity of the volunteer donor must be respected and accommodated. The role, important role, we'll see now, assessment. We have to do all the aspect of the assessment, the nurse, and the patient current fears and concern, barriers to learning and current pain, and knowledge of the disease status. Okay, because the patient may have the other problem also, cancer with the diabetes and hypertension and or any renal problem. Knowledge of the transplant process, how they, whether really they are understand depth, knowledge of the patient rights and responsibility, which I have explained. When participating in research medical, usual coping strategies, everything to be explained. And also the nurse's role to develop the fatigue and usual sleep pattern of the patient experience in healthcare environments, the previous admission is there, or commitment and barrier to learning, any allergic of the medicines the patient or the food, current medication and knowledge of the purpose, and adherence to taking medications, a culture for the presence of antibiotic resistant organisms also to be important to be noted, current center venous success, history of the central venous state access will be noted. Other teachings and also the home infusion companies and administration of the home infusion, clinical logistics, that is how to access for the care for the after hours, importance of the having caregivers and the various spaces, and the purpose also the procedures from the beginning to the end to be explained, laboratory tests, scans, and overall transplant process, complication what will be happen, and pre-operative teaching, everything to explain to the patients. And care coordination is very important to assess ability to adhere to workup schedule, confirm financial clearance for transplant, social work assessment, nutrition. And here the medical care, the plan, maintain working knowledge proposed for transplant plan for patients, ensure all workup studies obtained in the timely manner. Preconditioning, the nurse's role, important role here, getting the concerned, supporting the medical staffs, plan to ensure the much possibilities and informed decision regarding the HCT. Here the donor preparation also very important for the HCT recipient. The patient is the donor have been called forgotten patients of transplant. However, donors also have concern about their own health and procedure they will undergo for whole whatever the patient, whatever the whole thing or considering for the patient, same like for the considering for the donor also. It is ideal for the donor to have a primary nurse with whom they can establish a relationship and who can prepare them for the HCT preparation and collection, monitoring them for throughout the procedure. And also it should be actually done in the accreditation health center, and the donor must have cared for by a different physician than the transplant recipient. Thank you for patient listening. These are all the reference.